Welcome everyone to our first video about breast cancer. Today we review the anatomy of the breast and we'll see what implication it has when we study breast cancer. Number one, we'll start by the chest wall. We also see the cross-sectional appearance of the ribs. Number two labels the pectoralis major, which is one of two pectoralis muscles, namely pectoralis major and pectoralis minor. Number three labels the lobules of the breast. Number four labels the nipple. Number five labels the areola. Number six labels the milk duct. Number seven points toward the fatty tissue of the breast. And finally, 8 for the skin overlying the breast. Also, we have fibrous tissue known as the Cooper's ligament, and overall the breast is composed of fat, ducts, and glands. The lobules, described by number 3, is where the actual breast milk is produced. Additionally, we must remember that axillary lymph nodes are labeled based on their relationship to the pectoralis minor. The first level is lateral to the pectoralis minor, while the second level is exactly under the pectoralis minor, and the third is medial to the pectoralis minor muscle. The rudder node is known as a node that will be between the major and minor muscles of the pectoralis. Additionally, it is important to know that the majority of the blood flow for the breast comes from the internal mammary artery. This artery actually supplies about 60% of the breast. Finally, when we review imaging or when to perform imaging, whether we're talking about mammography or breast MRI, the best phase is the follicular phase. And the reason for this is because the estrogen is a hormone that dominates during this phase. This is the best time to have a mammogram or to have an MRI, and this is roughly between day 7 and day 14, or a more narrow window will be from day 5 to day 10. But overall, the follicular phase is the optimal phase to get imaging, whether it's mammography or it is an MRI, because it will facilitate the visualization of the structures during this time. Finally, another important concept is regarding lymphatic node or lymph drainage. The lymphatics or the lymphatic drainage is approximately 97% to the axillary lymph nodes. And like I said, the anatomy will correlate with our findings on breast cancer. For example, a large majority of the breast cancer metastases to lymph nodes will go to the axillary lymph nodes. The other route will be the internal mammary lymph node. However, this is much less likely in the absence of axillary lymphadenopathy. In this case, it will be a ratio of 97% axillary drainage versus 3% internal mammary drainage. With that in mind, we conclude our first section on the anatomy of the breast. Thank you very much.